Hi there, my name is Mohammed and I'm a third year medical student studying in London, and I hope you're having an amazing day. So in today's video, we're going to talk about type 1 respiratory failure. So respiratory failure happens when the lungs are going to fail at fulfilling its main job, which is to get oxygen in and take carbon dioxide out. And there are two types of respiratory failure. There's type 1 and there's type 2. So in today's video, we're going to be focusing on type 1 respiratory failure, and we're going to do type 2 in a future video, okay? So in today's video, we're going to go over the definition of type 1 respiratory failure and how it's diagnosed and what causes it, and finally its long-term complications on the body. Sounds good? So I just want to let you know that this video is just going to be a brief overview about type 1 respiratory failure, and I'm not going to mention all of these tiny details that are going to happen in type 1 respiratory failure, because we're going to do these because we're going to go over these things in a future video, okay? So if this sounds interesting, then let's get right into the video. Okay, so before going over the definition of type 1 respiratory failure, type 1 respiratory failure is going to be diagnosed by getting an arterial blood gas, or an ABG. And an ABG is basically getting a sample of arterial blood. And in order to find out the partial pressure of oxygen, or the partial pressure of CO2, it can also tell us the pH of the blood and the bicarbonate, and also it can tell us the concentrations of the various electrolytes in the blood. Okay, so it's diagnosed by getting an ABG, an arterial blood gas. Okay, arterial blood gas, or an ABG. Okay, so when someone with type 1 respiratory failure presents to, say, the hospital, and we want to get an ABG from their radial artery, what are we going to find in the ABG? What can the ABG show? In someone with type 1 respiratory failure, they're going to have a low partial pressure of oxygen with or without a low PaCO2, partial pressure of carbon dioxide. In other words, in patients with type 1 respiratory failure, they're going to have hypoxia with or without hypocapnia. A low PaO2 with or without a low PaCO2. Okay? So now we know that in type 1 respiratory failure, there's going to be hypoxia with or without hypocapnia. Okay? So, what are the things that can happen in the lung which can cause hypoxia? Okay? So there are 4 potential things that can happen which can cause hypoxia. So the first thing that can happen is a VQ mismatch. Okay, in other words, it's a ventilation to perfusion mismatch. So in order for the lungs to function effectively, the ventilation has to match the perfusion in order for the lungs to carry out its main functions. If the ratio of ventilation to perfusion is all over the place, there's no match between them, then hypoxia is going to occur. And when there's going to be a VQ mismatch, there can either be a high VQ mismatch or a low VQ mismatch. So if there's a high VQ mismatch, it means that the ventilation is going to be much better than the perfusion. And we're not going to go over in detail about these things, because we're going to go over these things in a future video. So I'm just going to mention some of the diseases that can occur in these different scenarios. So if the VQ mismatch is high, then disease such as pulmonary embolus can happen. So a PE can result in a high VQ mismatch because the perfusion in a PE is low. if there's a VQ mismatch, also a low VQ mismatch can occur. And it can happen in diseases such as asthma or COPD. And this is because asthma and COPD are obstructive diseases, and therefore the ventilation is going to be much poor, and therefore the perfusion is going to be much higher, which is going to reduce the VQ mismatch. So overall, if there's going to be a VQ mismatch, there's going to be hypoxia. Okay? What is the second thing that can occur and which can lead to hypoxia? A shunt. Okay? A shunt happens when blood from the right heart is going to go through the lung, but it's not going to take part in gas exchange. And it can happen in diseases such as pneumonia or pulmonary edema. Okay? This is because, see, in pneumonia, what happens is that we know that pneumonia is an inflammation of the alveoli. There's alveolar inflammation, then there's buildup of exudate in the alveoli. And as a result, there's going to be, then like gases are going, like oxygen is going to have a hard time passing from the alveoli into the pulmonary capillaries, leading to hypoxia. Okay? So a shunt. The third thing that can happen is diffusion limitation. Okay? In some diseases, the respiratory membrane is going to become really thickened. And if the respiratory membrane is thickened, what's going to happen to the diffusion of oxygen? What's going to happen to the rate of oxygen diffusion from the alveoli into the pulmonary capillaries? Is it going to be the same or low or high? It's going to be much lower. The rate is going to be much lower because of the increased thickness of the respiratory membrane. So less oxygen is going to be able to diffuse from the alveoli into the pulmonary vessels, and leading to ending up with hypoxia. Okay, what else can happen? Hypoventilation. Hypoventilation can result in hypoxia. Hypoventilation is when there's less air from the atmosphere reaching the alveoli, and as a result, there's going to be less gas exchange taking place. And not only this can happen, not only hypoxia is going to happen, but because there's a reduced rate of gas exchange, there's going to be accumulation of CO2 in the blood, and leading to a higher partial pressure of carbon dioxide. So not only there's going to be hypoxia, but there's also going to be hypercapnia. Okay, so these are the four main things that can happen in the lung, which can result in hypoxia. Okay, so VQ mismatch, okay, a shunt, diffusion limitation, and hypoventilation. So finally, what are the because there's hypoxia in the body, okay, what are the long-term complications that can happen as a result of hypoxia? So the first thing that can happen is pulmonary hypertension. Okay, and I'll explain why. Pulmonary hypertension. So what happens? So when oxygen is going to pass from the alveoli to the pulmonary circulation, what's going to happen is that oxygen is going to activate the release, or it's going to stimulate the release of nitric oxide. And what nitric oxide does is it's going to cause relaxation of the smooth muscles of the pulmonary vasculature, which can lead to reduced pulmonary vascular resistance, which will reduce the blood pressure of the pulmonary circulation. So what happens if we have reduced oxygen? What's going to happen to the release of nitric oxide? There's less nitric oxide is going to be released, and as a result, there's going to be a higher pulmonary vascular resistance, increasing the blood pressure of the pulmonary circulation, leading to pulmonary hypertension. And pulmonary hypertension is going to have really terrible consequences on the body, because it can lead to heart problems such as right concentric hypertrophy of the right ventricle, because the right ventricle is trying to withstand the blood pressure in the pulmonary circulation. And that concentric hypertrophy can lead to the right heart failing and leading to like really terrible symptoms which can affect the quality of life of the patient. Okay, so the first thing is pulmonary hypertension. The second thing that can happen is, because there's hypoxia in the blood, okay, in the kidneys there are these proximal fibroblast interstitial cells, and these cells are going to sense hypoxia in the blood. And if there's hypoxia in the blood, as a result, they're going to start by releasing erythropoietin or EPO. And EPO is going to increase the rate of erythropoiesis in the bone marrow in order to increase the red blood cell count in the body, so that because there's hypoxia, we want more red blood cells to carry, we want more red blood cells in the circulation, so that more oxygen is going to be carried in the circulation. So if there's a higher red blood cell count, what's going to happen to the hematocrit? The hematocrit is going to rise, and that's not good, because if it rises too much, that's not good, because it can lead to hyperviscosity, which can lead again to really bad consequences to the body. Okay, so secondary polycythemia. Okay, what else can happen? Hypoxia is going to mainly affect the vital organs in the body. It can have have effects on the vital organs in the body, such as the kidneys and the CNS and the heart too. So it's going to affect the kidneys. If it affects the kidneys, then it will lead to renal impairment. Okay. It affects the CNS, and it's also going to affect the heart. So pulmonary hypertension, secondary polycythemia, it's going to affect also the kidneys and the CNS, the central nervous system, and the heart. So this is just like a brief overview about type 1 respiratory failure. I know I didn't mention the details about what are the things that can happen in type 1 respiratory failure, and I'm going to make separate videos about each of the mechanisms that can lead to hypoxia, the VQ mismatch, shunt, diffusion limitation, and hypoventilation in future videos. So if you found this video informative, and if you have enjoyed the video, please leave a like and subscribe for more videos like this in the future, and I'll see you next time.